First of all, the public health report card has come out this year and you've taken a look at it. What are your thoughts about it?
Well, we certainly do have some high rates of things that are bad and low rates of things that are good. Like, for example, we have the highest rates of low birth weight and very low birth weight babies. However, if you look at our infant mortality rate, it has gone down over the past several years, and over the past year it has really gone down to fewer than 9 babies per 1,000 die in the state, and that's the first time we've been below 9, so that's a good thing. And we've had a decrease in our SIDS deaths. So we can improve things, and there are some things we're improving on. We still have a very high obesity rate in the state, but we're no longer number 1, and it seems to have evened off, and in some portions of our population it's even decreasing. So we can do things about the health issues in our state, and some of them are improving.
Yes, and that's excellent news. It takes a while, but we are improving.
It does take a while.
But I think that's important for Mississippians to know and the medical community that it doesn't happen overnight, but we are starting to see some movement.
Right, and we can make a difference. You know, if we all work together in homes, in communities, in business places, in schools, and make sure that our policies are in place so that the healthy choice for the individual is the easy choice. So if we have the healthy foods that are available and a way to exercise in communities, and if we could have a statewide smoke-free air law, that in itself, not allowing smoking in public spaces, indoor public spaces, that would change our rates of cardiovascular disease deaths and stroke deaths in the state. So just that one thing would make a big difference for the state.
And even as you touch on that, we have for the past couple years been number 1, I think twice, and number 2 once for having the most smoke-free cities. And while that is not the final answer, again, it's showing some progress in healthy thinking.
We've had more communities go smoke-free in this state than any other state. We have gotten awards for that. But we still are only covering less than half of our population, I think like 25% of our population with smoke-free air laws or policies. Even if we get every community in the state covered, we would not have the whole state covered because so many people live in rural areas in the state.
Well, today is the 50th anniversary of the Surgeon General's report, and we're putting out a press release about all of Mississippi's accomplishments. And if you think back, I think, again, this is good news for our medical community, and surely they've played a part in it, that we have changed how people think about smoking.
Right. And even though we have an adult smoking rate that is among the top 10, we have in this state had a vast decrease in the number of adults who smoke. It's about 23% of adults smoke now, and it used to be over 50%. So there have been improvements. Even though we're still not doing well in a lot of those health-related areas, there have been improvements.
And surveys show over and over again, over 80% of Mississippians favor a statewide smoke-free air law.
And that would be the one thing that the legislature could do and the governor could do that would change the health of this state markedly, that one policy.
With the sign of the bill,
Right.
It would. I guess my last question to you is this report card focuses on children and education and health, and we're certainly grateful for the legislation in 2007, and I think we are seeing differences now, aren't we?
Absolutely. The 2007 Healthy Students Act, I think, has made a big difference. What kids eat in high school and the amount of exercise, or in elementary school, and the amount of exercise that they get has changed because of that legislative action in 2007. And we've seen differences in the children, in the obesity rates, and in what they eat, and in what they're willing to eat has changed as well. So that is a very good thing.